Hi, we've talked about core myth, and now I want to talk about how that links into what we're doing. For the step 13 process, we're on a whole new plane. There is a parallel reality in our methodology, which has to do with a reality of past traumas that have accumulated over the years starting early in life. And that parallel reality follows us invisibly around, unknown to us. And when there's a stress, the emotions from the past trauma come flashing in and become very upsetting, causing maybe a panic attack, possibly a rage attack, possibly a relapse. Now, this is not in the psychiatric literature, it's not in the common literature, it's just not out there yet. But we've discovered it by our own observations and research. And we found that with the awareness of this second parallel reality and the flashbacks, we call them subliminal flashbacks because you don't know you're having them. You don't have any memory of what you're flashing back to. You only have the emotion relating to the trauma that's there in that parallel reality flashing over to where you are. Whatever triggered you, might be your mother yelled at you, and you get a blast from the early life trauma, which might have been your sister went to the hospital and almost died, and your mother blamed you. And that has nothing to do with the present events that may be happening, but you're getting blasts of emotion from that earlier trauma without any awareness where it's coming from. You just think you're horrified because your mother yelled at you, but that's just the surface of it. Now, this particular idea is new. No doubt you've never heard of it before. Subliminal flashbacks. It represents a short circuit in the brain that when there's an emotional trigger, that memory bank discharges emotion from that last event and blasts through to your conscious state without any awareness of where it's coming from or why or how. But what we've learned is as people become aware that there's a parallel reality out there and any trigger is likely to set off emotion coming in, blasting in, and of course you only see the trigger, so that's what you think it's coming from. But the awareness of that whole process changes everything because the focus now is getting past the original trauma, not whoever yelled at you that you didn't like, because this past trauma is always going to be there and it's always going to be flashing in every time there's a stressor. So that's the thing that has to be worked with. Basically, your PTSD, post-traumatic stress disorder. Until you realize that, you're just going to be flying around not being able to deal with situations because you're always reacting to the wrong thing. Now, this particular awareness may sound logical, it may sound ridiculous to you right now, but to put it into your thinking process so when the trigger comes, you say, oh, this may be the flashback. That can take 2 years before you automatically begin thinking in that direction. The normal way of thinking, and I say normal in quotations, the normal way you usually think is with one of 5 ideas. And these are the 5 ideas that you're programmed in now to think with. And it's poor me. Look how hard I try. See what you made me do. If it weren't for you, and now I've got you, you son of a bitch. Those are your 5 ideas to handle stress. And all of them are dysfunctional. The idea you want to put in its place is the idea of, oh, this is coming from a flashback. And what that flashback is too. And what triggers in the flashback is the core myth. So if I feel like I'm a failure, that's my core myth. And somebody says, you didn't get that work done on time. And that triggers my core myth. And that flashes back into my father yelling at me for not getting my homework done. And I get a blast of terror. The person that told me about the job not getting done makes me in terror, makes me feel in terror. If I don't know how that's linked in and how it's linked to my core myth, then I'm just going to react badly, be upset, and maybe do something I shouldn't do. This awareness takes a long time to program in. The person doing a layup shot will do 1,000 of them before he can do it right. The musician will do scales for 4 years before he can play the piano, and so on. The boxer has to teach himself not to blink when the opponent faints, because if he blinks, he's unconscious the next second. These things are neural pathways that have to be put into the brain, and they have to be programmed in and practiced. But once it is in there, you're on a different consciousness level altogether, and you're ready to move forward.